For most women, pregnancy is a wonderful and exciting time in her life. However, there are some women who are scared to seek prenatal care. They're afraid of being ridiculed by their doctor or losing custody of their unborn baby. The reason for this is they have a substance abuse problem. Some women are so consumed by the need to get their next fix that they never seek any prenatal care at all, and the first time that they will see a physician will be when they're in the hospital having their baby. These mothers, they are addicted to opiates. They will likely have a baby who is born addicted as well. In 2013, according to USA Today, 921 babies in Tennessee were born addicted to opiates. This condition is called Neonatal Abstinence Syndrome. It's also referred to NAS for short. An opiate is a drug such as heroin, codeine, or Oxycontin, just to name a few. When the mother takes these drugs during pregnancy, it's passed from the mother to the placenta, and the placenta gets to the baby. And when a baby is exposed to these while the infant is in utero, you have a 70% chance of being addicted. After birth, withdrawal symptoms usually begin within 1 to 3 days. They can take up to 7 days to manifest, and the symptoms of NAS vary by the infant and the severity of the addiction. The neurological effects can be irritability, increased wakefulness, high-pitched crying, tremors, increased muscle tone, hyperactive reflexes, sneezing, and seizures. Some gastrointestinal symptoms can include vomiting, dehydration, poor weight gain, and poor feeding. They can have uncoordinated sucking, and they can also want to constantly suck. Some symptoms of the nervous system are sweating, nasal congestion, fever, blotchy skin color. Their temperature is unstable. They can have high blood pressure, and they can also have an increased respiratory rate. These symptoms were published by Iowa's Children's Hospital. NAS can last anywhere from 1 to 6 weeks. A doctor must diagnose NAS before treatment can begin. The doctor, they will ask the mother about her drug use, and they will also do a toxicology report on the meconium. That is an infant's first bowel movement. Once a diagnosis has been made, a care plan can be created for the infant. Oftentimes, a doctor will prescribe something similar to what the infant is addicted to and slowly wean them off so that their withdrawals are not so severe. Other things that can be done to help the infant to comfort him or her is being held. Also, swaddling can help. And what swaddling is, it's wrapping the baby tight in a blanket. It makes them feel like they're back in their mother's womb and basically just comforts them. Some studies have been done that suggest that breastfeeding can help lessen the severity of withdrawal symptoms. Some long-term effects that can affect the children are hyperactivity and short attention span in toddlers. In older children, they can have memory and perception issues. After explaining some of the symptoms that can happen when an infant is born with NAS, it's only fitting to go over some of the options available to the mother. If it is considered safe by her OB, she should stop taking these drugs. There are rehab options out there for pregnant women. One of these is called Families First. It's located in Johnson, Tennessee. They offer a program called Woven. It helps mothers who have drug and alcohol abuse problems. They offer counseling, training in life skills, they have parenting classes, and they also offer reverse birth control options for after the baby's born for the mother. Another positive for a mother seeking treatment while she's pregnant is it can also protect her from legal ramifications, because if she's undergoing treatment and the baby is born addicted, she's showing that she's trying to improve herself. Sometimes it is unsafe for the mom and baby to stop taking these drugs during pregnancy. When this is the case, the doctor can prescribe methadone or something similar. And the doctor will monitor the mom and baby throughout the pregnancy to make sure everything's okay. When the mother switches from her drug of choice to methadone in pregnancy, the baby has a 40% chance now of being born addicted to drugs instead of the original 70% if she would have stayed on her drug of choice. In conclusion, an infant born with NAS well, it'll be a challenge for them to overcome. But with treatment, the symptoms can be lessened. Also, for moms out there who are addicted to these drugs, don't be afraid to ask for help. These people, they're out there to help you, and they want to. So just come and ask, and there is options for you. And if you don't know where to look, I'm sure that your OB could probably help you. If you have any questions for me, just post below and I'd be happy to answer. All right, thank you so much for listening.